I'm a mechatronic engineer by training, and I started in this space after the traumatic birth of my second child, Ollie, who's also the namesake for the technology. Being my second child, I'd already gone through the whole birth experience once, and it was, the closest you can get to an amazing experience, and Ollie was quite a contrast to that. As an engineer, I found myself questioning why and how it could help. And I had an idea that of the differences, that how we could capture that and translate that into something we could measure and help other women make sure no one goes through what I did or worse. When I started this, no one denied it was a problem. Every single person, be it midwife, be it mother who was attached to the current technology and had her own experience, be it obstetrician, be it father, everyone knew it was a problem. And everyone had acknowledged it was a problem, but no one thought it was their moral obligation to fix that problem or make it a solution. It was someone else's problem. And I think that's a big thing, is it's not easy. And I've definitely learned, I've got the scars, I've definitely learned it's not easy in this space. And I think you need to step up and make it happen. And I'm sure there's many more spaces I can think of that we need to get more people stepping up and making it happen. And that's not just me, it's all the hospitals, the clinicians, the mothers, the team that we've got that have supported us along this way. Each of them, and you highlighted Tara stepping over, had to step up in some way to make this happen. Investors have to step up to make it happen. The general foundation of how Ollie works is, instead of looking at just the classic signals that we do in obstetrics monitoring, so it's very common when you see an obstetrics monitor, pretty much everything on the market that monitors is looking at fetal heart rate and contraction presence. We're not saying that there's anything wrong with that, but in isolation they don't tell you the details that Ollie can tell you. What Ollie's doing is looking at the mother and baby as a system, and what we use, so this is the Ollie hardware or device that we were talking about. It's actually a multimodal system which consists of a range of different sensors that give us information around not just how baby's doing, but also how mum's doing in response to that labour process. So say in the case of postpartum hemorrhage, we see very clear indicators and changes early in that labour process that let us know well before there's any postpartum bleeding that mum's likely to have a postpartum hemorrhage or excessive bleeding, which, if we've got those precursors early and telling us, just because at the moment the current standard of care is to watch and wait for that blood to leave post-birth and estimated in a puddle on the floor or on a mat, we've now got a method of actually responding before that first drop falls.
To date, we have 360 patients worth of clinical data, which has informed not only our postpartum hemorrhage capability, but a lot of the other capabilities on the Ollie platform. We have a trial currently running in Sydney, ethics approved through New South Wales Health, and that's running to complete 500 patients in the pilot study, and that is underway right now, and that should give us a lot more clinical evidence, not only on the postpartum hemorrhage, but on future applications for Ollie. The US is the target because it's the biggest market globally. For us, it's not our primary target just because it's the largest. It's actually our primary target because their performance in the US for maternal health outcomes is orders of magnitude worse than any other developed nation. Sort of 2.4 times more mothers are dying during childbirth and pregnancy in the US today than died 30 years ago, and that rate is getting worse. The prevalence of deaths from postpartum hemorrhage is increasing and getting worse, as are maternal health outcomes.
I think the big driving is making sure we can transform this space, and the only way we're going to do that is making sure we do it properly with the right investors and mindset.